All right, so just because, we're going to try and show every disease possible, slideshow. we're going to go to cancer, mainly because it's something that people don't think about a lot. I mean, the short-term air pollution, a lot of this research started in, mortality, because again, it was easy. We could tell if you were dead or not very quickly. There are large databases of death certificates. So it's relatively, none of these are easy, but it's relatively easy to figure out death counts for a city or for a country. You can do that pretty consistently across the world. It gets harder when you start to go to these other diseases. So you can count hospital admissions, you can count, asthma attacks, you can count cardiovascular, admissions or, treatments. It gets trickier when you start to go to things that are really long-term. And so cancer is sort of a unique animal in that, sometimes 5, 10, 20, 30 years are required to develop it. And so that poses a challenge to anybody who wants to study it, because you then have to find, one, you have to find people that you can track for that long, and two, you have to find air pollution you can track for that long, which until, the early 2000s wasn't possible. So again, we've seen this slide a bajillion different times, but particulate matter is mainly what I'm going to talk about because it's one of the big co-benefits of this expected plan. I mean, again, as Sarah sort of mentioned, there are a lot of health benefits associated with reducing climate change. We're just ignoring all that. This is sort of the stuff you're going to get for free if you pick the right plan, and I say right plan in quotes, but it's one of the interesting things about this law is that there's a unique opportunity to get something in addition to what you're really trying to get, and so sort of a nice thing. So in addition to the inflammation, particulate matter has also been shown to have actual carcinogens inside of it. So if you take these particles and you paint them on a rabbit, in a lot of cases you'll get skin cancer. You feed them to a rat for its lifetime, they get lung cancer. You name a cancer, there's a lot of cancer going on with a lot of these particulate matter because they're combustion processes, and that leads to sort of some nasty combinations of stuff. They've also really interestingly been shown to have pro and anti-estrogenic effects. So this becomes important in the breast cancer world when you're breathing in something that either makes it look like you have a lot of estrogen or a lot of testosterone, and what that does to different organ systems is not great. And in addition, particulate matter has been shown, especially because it has this translocating property, that it not only leads to inflammation, it leads to oxidative stress, and it can actually be shown to lead to DNA damage. So if you look at the DNA of individuals in areas of high air pollution, you get these adducts that form where basically these chemicals come in, they attach to your DNA, your cell can't appropriately repair your DNA, and then you have that sort of lifelong mutation, which could be a precursor to later carcinogenesis. So again, particulate matter, it's a nasty little guy. So again, this long versus short-term exposures. So most of the health benefits that you've seen in that very nice Nature paper were based on very short-term exposures. It was either daily levels of ozone or it was annual levels of PM2.5. So, they focused on the things they should focus on. There's a wide literature on heart attacks and premature mortality and respiratory outcomes. So one of the things that they couldn't build into that, because it's probably just would have been way too hard, was sort of longer term exposure. So where, exposures over years, decades, in utero have all been shown now to be associated with future development of cardiovascular disease. Cancer is really a place where this is even more problematic. So just because I like to show maps. How do you study this? So this is one of the questions. We've been talking about a lot of these studies, so I figured one of the things I would sort of talk about at the end is, where are all these studies coming from? And so you need at least two things. You need a place to find outcomes and a place to find air pollution. And so for cancer registries have always been a long-term source of finding information about cancers. They're well documented. A lot of states used to have them. There's more states that have them now. You could always use mortality records for cancers that kill people. So lung cancer has always been the classic one that was really easy to look up. Lung cancer cases, because the mortality, most people, 95% of people who get lung cancer are going to die quite soon with it. For other cancers that don't kill you, it's a horrible place to look, right? So if you looked at prostate cancer, that's not a great outcome to go find in mortality records. The work that I tend to do happens in long-standing cohort studies. So the Nurses' Health Study is a great example. In 1976, 121,000 nurses filled out a questionnaire, and they've continued to do that every 2 years. So we have a wealth of information on them over a long time period. That study was actually started to look at breast cancer outcomes, and so it's a very cancer-focused cohort, so it's nice to do air pollution research in. If you can't do that, a lot of people do case control studies, and so people are relatively good at remembering where they've lived throughout their lives. So if you go in and you find cases and you find controls and you ask them a residential history, you can go back and put air pollution measurements onto that and sort of look to see if it's associated. So this map, it's actually one of the researchers that I work with. He's basically developed this map with a combination of all sorts of source information and satellites and you name it, it's in there. And as we can see, we were in that zone of where the darker equals higher. And basically what we do with this map is, we have the addresses of all of our participants and we put a dot on the map and we pull the pollution for any given month, year, day out, and then have that information for a person. And with the so EPA sort of started doing some monitoring in the 50s and 60s. With the Clean Air Acts in the 70s, that monitoring network expanded and continued to expand. And so now we've actually got long enough time periods to look at where we don't have to look at daily exposures. We can look at decades. We can look at 20, 30 years. We have cohorts now where we've actually have people who we've had their pollution since the day they were born and they're now in their 30s. And so that's becoming a more valuable resource in terms of actually being able to look at these longer term diseases. One of the things I always like to bring up as an epidemiologist is that a key problem with air pollution is a lot of these exposures co-locate with other things that cause these diseases. So smoking rates tend to overlap in sort of a unique way with air pollution patterns in some, so states that have had really high levels of tobacco consumption in some cases also have really high levels of air pollution, not from the tobacco. That was what my students always ask is, well, it's just everybody smoking there, so there's really high air pollution. I'm like, no, well, maybe in their homes, but not in the general air. So, when you can take account of more of those, these become more believable. So just as a slide, because, I want these slides with the nice lines. This is every study as of 3 months ago that has looked at air pollution and lung cancer. And so this was again, I said lung cancer is easy to find because people die from it. And these happen to be the US studies. So if you're US-centric, you can look at that side of the map. If not, if I took the names off the bottom and you didn't know what countries they were from, it would make some sense. So again, what you see here is that the blue line is, everything above the blue line is bad. And you see here, pretty consistently, everybody's above the blue line. There's what is it? This is in California. It's in Seventh-day Adventists. But the interesting thing everybody thinks about that is that they have really healthy diets, and it seems to actually be helping them in terms of living in a polluted area. But again, this is about a 10 or 20% increased risk, depending on who says what. There's a lot of fighting about what this number is. But again, you see that it's pretty high. What's interesting is that this is a similar graph for NO2, and again, the US studies, and it's not as compelling. So this was really, this graph was put together by someone who was trying to say, is it traffic that's driving these associations that we're seeing with lung cancer? Because a lot of the earlier studies were saying, do you live near a major roadway? It's really hard to get pollution levels 30 years ago, but we know where the roads were. And so we can actually look and see if you live near a road and does that roadway exposure lead to your future risk. And it pretty convincingly doesn't. There's a wealth of literature in this on other cancers. The breast cancer literature is really growing rapidly right now, and it seems to be, I mentioned that sort of estrogenic, anti-estrogenic. There seems to be a pretty complex interplay between the type of breast cancer you get and the type of air pollution you're exposed to. Bladder cancer is also up there. That one's a little trickier. And so what happened is that IARC, the institution, it's in French, but it's basically the International Agency for Research on Cancer, about a year and a half ago, convened this massive set of panels where they had toxicologists and animal study people, they had exposure folks, and they had a bunch of epidemiologists all sit together in Lyon for about a week and a half and review the entire body of literature on cancer and air pollution. And we were actually somewhat surprised that they came back with a group 1 carcinogen. So those are things like tobacco smoke and all kinds of nasty industrial chemicals, and they came back with that for air pollution, mainly based on the lung cancer findings that I showed you earlier, is that they thought that the lung cancer and particulate standard basically necessitated this level. And all the animal and all kinds of other stuff sort of supported it. So, In conclusion, I think, although there's less evidence, I think, than the overwhelming, thousands of studies on cardiovascular disease, it looks like air pollution is also associated with cancer risk. And so in decades to come, you might not see the quick rebound. A lot of those studies were showing, if you drop pollution, your heart attack rate is going down next year, right? That's a much faster monetization of your investment. But I think, if you're thinking long-term, in 10 to 20 years, your cancer rates may go down as well. So it's kind of a nice side benefit to any sort of plan like this. And I think, one of the interesting things is this hasn't been monetized or explored at all because it's a more relatively new literature. And so it's just an interesting thing to think about.